We are here basically to provide people with a place that they can bring any old, unused, unwanted, or expired prescription drugs and dispose of them safely. We have law enforcement out here who can take all your prescription medications, and they're going to get rid of them in a way that's safe for the environment and also make sure they don't get into the wrong hands.
Tell us, why did Blue Cross and Blue Shield get involved?
Blue Cross is really trying to establish ourselves as a wellness company. We want people to understand that we do a lot more than just pay your claims when you get sick. We want to help prevent sickness. We want to help people keep their good health. And one way to do that is educate people about safety with drugs. And, you know, this is really a big public health issue. Unfortunately, a lot of abused drugs come from home medicine cabinets. Teenagers get hold of them. Little children and pets can accidentally get hold of them. And, you know, people of any age can get sick or get accidentally poisoned if they take an expired drug. So we're really just encouraging people to do that spring cleaning, clean out your medicine cabinet, bring your medications out here, and if they miss the opportunity today, they can still go to the DEA website, which is dea.gov, and find some other safe ways that they can dispose of that medication.
Why is this an important cause?
It's an important cause for two reasons. We really see it as both a public health issue and a public safety issue. Safety because if you don't dispose of drugs correctly, they can get into the groundwater, they can affect animals, wildlife, and even people. But it's really, the bigger issue is the public health issue. Unfortunately, a lot of teenagers are getting high for the first time now on prescription drugs, many of which come straight from their parents' medicine cabinets. And it's an unfortunate thing that this is growing, that prescription drug abuse is now second only to marijuana use as kind of the biggest drug abuse problem in America. So we really are trying to help people avoid that possibility and also just avoid the possibility of any accidental poisoning or people getting sick from taking these old medications.
One of the biggest problems we have in the country are prescription drug abuse. A big problem that we have is teens across the country every single day get high for the first time on some type of medication that they get out of their kitchen cabinets. So if we can get those out of the kitchen cabinets, get them away from that possibility, we're making households safer. Blue Cross got on board and really helped push the event and really promote the event, so we have more awareness, and they're really big on awareness. You know, they push the drug awareness and the dangers of prescription medication abuse. So this is just another step to get that out of your households.
How often do you see prescription drug abuse on a daily basis?
Every day. Every day we deal with prescription drug abuse, be it if we're having people who are doctor shopping, we have people who are stealing so they can get money to pay for prescription medication. Crashes, you know, we work crashes and arrest people for DWI all the time, and a lot of times you talk in the middle of the day on a Monday, and these people are addicted to prescription medication. It's obviously a problem, but a problem that we keep fighting. We're going to continue to fight with the help of DEA and our local partners, and people like Blue Cross and Blue Shield really push out that awareness and that education.
We'd like people to keep in mind that they shouldn't keep old or expired medications around the house. So keep that medicine cabinet cleared out. If you have medications that are expired, there are safe ways that you can get rid of them. If you're not sure how, ask your doctor or ask your pharmacist. Or you could also go to that DEA website, the Drug Enforcement Administration, and you can look up some safe ways to get rid of your medications.
They can contact us or they can contact DEA, and we can make sure that we get that properly disposed of. We don't want them throwing it in the trash can. We don't want them dumping it in the sink or flushing it down the toilet. We want it properly disposed of, and we can help to facilitate that.
What are the dangers when they're disposed of in that fashion?
Well, improperly disposed of, you know, you have, if you're just throwing those things away in the trash, you're making that available for just about anybody to get their hands on it. And people who are addicted or desperate to get their hands on those kind of things, they'll go through great lengths to do that. So we want you to do it in a safe manner where we can take care of it and make sure that it's taken care of. It's disposed of properly. These are taken, it's incinerated. There will be nothing left of these drugs.
I think they should ask their pharmacist or ask their doctor. That's probably the best way to do it, because pharmacists especially are the most knowledgeable about how to get rid of old or unused drugs.